You know, ending homelessness or institutionalization for people with disabilities is an important civil rights and moral issue, but it's also a real opportunity to convince the deficit hawks of this world that it is also something that can save money. And events like this really are important in moving that agenda. All 9 of the proposals are incredible, and I commend APT for the paper. I think more than any one proposal, what we need to do is think about how we scale this up, because we have to substantially reduce homelessness and institutionalization and demonstrate that this makes fiscal sense with a unified vision, though, of how this can be done. The first panel mentioned a lot of changes in the supportive housing model that have occurred over the last 20 years from, they didn't mention this, but it's really a concern of mine still with some proposals I see out there, that we don't need mandatory services. We need voluntary services. We don't need provider-owned housing. We need housing that emphasizes the separation of housing and services and lets everybody do the job that they know how to do. We're really focusing more on mainstream programs, and I think that's really great. Partly it's because we don't have the money in the boutique programs anymore, but maybe that was a good thing that it got us focused on things like Medicaid and vouchers and public housing. I also think there's a couple of things that we could do better, and I want to mention those first. The first is I really wish we could eliminate the silos that separate homelessness from disability. We're not helping ourselves to maintain that separation. That's one of the reasons I think that the Medicaid folks maybe didn't have as much data on the cost effectiveness, because that data is mostly in the homeless system. It's actually easier to get the data in the disability world because you can tell how much money you're going to save if you take somebody out of an institution. Excuse me. So let's try to do that. I think that would be a huge help. Let's also figure out the terminology. The paper makes mention of a special model of permanent supportive housing. I don't really think there is. You know, we have words like supportive, supported, permanent supportive. You know, it's all one thing, and let's just figure out what to call it. I vote for permanent supportive, but I'll do any of the above. And then around cost savings on the housing side, there was, this is only a footnote in the paper, but it made note of Dennis Culhane's study, which was fabulous in the 90s to have. But, you know, we're not paying to construct housing now for supportive housing. We're paying rent or operating subsidy, and that costs so much less than what a lot of the literature says in it about how much it costs to produce a supportive housing unit. If we layer on subsidies like 811 onto onto the tax credit program, the housing under the tax credit program is going to be there anyway. We're just using it for supportive housing. The cost argument becomes incredibly compelling, I think. I know there are a few people in the room who expect me to talk about this, so I'm going to do it first. Proposal 4 on the fair housing issues. This is the most important proposal in the paper, in my view, and it relates directly to Proposal 3, because you can't use vouchers in public housing and the HUD-assisted housing portfolio if you don't have preferences that allow you to get these people into the units. It also relates to proposal number 5, because most tax credit properties will have some kind of HUD money in it. If you ever tried to figure out the different fair housing rules for all of that money, your head would spin. So, with all due respect to the disability rights attorney and advocates, tenant selection preferences that target money follows the person or people who are receiving certain Medicaid long-term care services through 1915C or the 1915I option or an 1115 demonstration waiver. It can't be illegal, since those are there to prevent the institutional bias associated with Medicaid and give people an opportunity to comply with the ADA at the state level. How can they be illegal from the HUD fair housing perspective. I just don't understand it. I know HUD's concerned about segregation and compliance, and I get that. But I really urge HUD and HHS to come together and develop some clear guidance. I think CMS could be very helpful here, that limits these preferences to people receiving certain long-term care services that are either done under Medicaid or a comparable state financed benefit if a state is still using its mental health money to do assertive community treatment, for example. Proposal number 5, Carol mentioned the 811 demonstration program. We were so overjoyed. I thought it was 35 states that applied, and so it's 36. The number keeps going up. What is that? Oh, including the District of Columbia. Okay. What does this tell us about the demand and the willingness of state housing agencies and Medicaid agencies and HHS agencies to work together? Many of you may not know what the 811 program does, but it provides a framework that is not just about 811. It allows states to take this partnership and define the target populations they want to help, which could be a mix of people with disabilities in institutions and people who are chronically homeless. It creates a service commitment structure, primarily, hopefully, around Medicaid and probably managed care, and then a referral infrastructure to make sure that people get to the housing. Once you have that, you don't need to have that just for 811. One of the state applicants I know proposed, I won't say exactly how many, but let's say 500 units of 811 housing. And then they went out and they got 500 commitments of vouchers from 5 PHAs to go along with the 811 units. So they're going to create a 1,000-unit program, and they could do the same thing next year and the year after. So I just think that's huge. Around the managed care issue, you know, we've done some work in Louisiana. I know ASPE is going to be looking at that work, and and maybe there'll be more information on it. But if the state knows the right things to put in the managed care procurement, then those things get adopted in the managed care contract. So Medicaid folks really need to know enough about this to be able to write good RFPs, pick the right companies, and write the right contracts. So thank you for the opportunity.
And I'd like to ask a couple of follow-up questions. I heard you talk about, you know, the important trend towards models of supportive housing or supported housing in which services are not mandatory. And I also heard the earlier panelists talk about light touch services that in these mixed settings are necessary for the development as a whole in order to make it work. Where's the boundary between the kind of services that are mandatory and the kind of services that you don't think people should be required to accept as a condition of their living and housing? Well, let's start with the fact that Medicaid services can't be committed to a building. I think that's an important point. Medicaid services are committed to a person, and so they can't be mandatory. At least I don't think they can be mandatory. I'm looking at my friend John O'Brien in the back. Light touch services are services that really are building-based, I think. And so there's a real difference between those two. Are we stuck with HUD funding of those building-based services then? You know, I hope not, but I also think it's fairly, I won't characterize it. I think it's not going to happen in the near future that we get payers like Medicaid to pay for those services. You know, it's too bad that we can't underwrite for those in the context of rents, and Bill may have a lot more to say about that. I look to him for a lot of this expertise because I'm not as expert on the different ways that the light touch services can be provided. But certainly if we're looking at Medicaid as a payer, the issue of mandatory services goes away. One of the recommendations we threw in here as part of, I guess it's number 5, is that there should be a bonus pool at the federal level for states that dedicate some of their low-income housing tax credits to to supportive or supported housing. Nobody's spoken to that, and of course, this is a proposal that has federal budget implications. Do you think it's necessary, or based on what you've seen as the response to this 202 competition, do you think states will do that anyway? They don't need a federal incentive to do it.
Oh, I think incentives are fabulous, and I think the more incentives we put on the table, the better. And I'm sorry I didn't comment on it. It was in part of what I crossed out when I realized I thought I could have 10 minutes, and then I realized I could only have 5.